Hi, it's Dr. Sharon Lark. Today I'm here with Jasmine. Jasmine's a longtime patient. She's been with me about 5 years and she's been getting regular care, and now Jasmine is pregnant. Congratulations.
Thank you.
How far along are you?
I'm 28 weeks.
Wonderful. So I wanted to address today some questions or concerns that someone might have getting care while they're pregnant. So I'm going to go ahead and ask Jasmine to let me know any concerns that she's thought of or friends who are pregnant have thought of over the years.
How is it beneficial for pregnancy?
So the thing is when you're pregnant, you're starting to, as you get larger, you change your center of gravity as baby gets bigger. And when you change the center of gravity, it throws off where you hold weight and how your spine is. And so it can start pulling on the lower back and creating pressure and problems. So chiropractic can be really beneficial, helping with low back pain. The other thing is the nerves in the lower back go to the uterus as well as the bladder and the intestines, and pressure on those nerves is going to create problems or make symptoms worse. So you want to make sure that you're getting all the nerve supply to those really important areas as much as possible. So sleep, having back pain, things like that, it can help with those issues. The other thing is we produce a hormone called relaxin, and relaxin loosens all the ligaments so that over the course of 9 months, everything's loosened up enough that the pelvis can open up for delivery. If we think about the extra weight on ligaments that are now stretched, things can get out of alignment and cause pain. So we want to make sure that everything's in good alignment. And any other questions?
Yes. How does it help with labor?
Great question. So again, we talked about we want things lined up. If your pelvis is out of alignment, it changes the shape of where baby's coming through. We want it to be open and have as much space for baby to come out. And if you have the pelvis properly aligned, the pressure off the back, you're going to be more comfortable. It's going to make you more relaxed. And we've had patients over the years say they've had pregnancies with and without chiropractic care, and they say it's much, much easier going through labor with chiropractic. Actually, their whole pregnancy, but especially labor.
What about with sciatic pain? I do get sciatic pain, not too much, but I get pain.
So the sciatic nerve comes from the lower back, goes into the butt area and then down the legs. When things get out of alignment, things can slip and start putting pressure. So keeping things in alignment will help with that. So that's a really, really uncomfortable thing to go through. So we want to make sure that we stay in good alignment, pressure off the nerves so it doesn't irritate that.
Okay. And then is there like a time of when to start chiropractic or when to stop or when to avoid it? Is there anything in between?
Got it. Great question.
What's recommended?
Yeah. The fact that you've had care all this time is probably the best case scenario because your spine is used to being in a good position. So when you have that extra weight and pressure, it knows where it's supposed to be, although things will get a little looser. There's not really a concern with an endpoint because actually it's going to give you ease throughout your pregnancy. It's very safe to be adjusted during pregnancy. And when we've had a number of patients come by on their way to the hospital to get adjusted to make sure that during their delivery everything is good and lined up and all the nerves have pressure taken off them so that they can have the best delivery possible.
Oh, that's good to know.
Yeah.
I know where I'm stopping by first.
So if you do have any questions that you'd like me to answer about chiropractic and pregnancy or delivery, please leave them below in the comments.
Oh, and I have one more question. What about after delivery?
So after delivery, I've also had a lot of patients come on the way home from the hospital and get checked because you're working very hard and hospital beds and the all the positioning and stuff, you can be uncomfortable. We can definitely adjust you right away. And we can also check baby, since baby's just come through a little bit of a rough ride. When you take the head, pull, twist, turn, sometimes things can get misaligned. And we like to check and just make sure that baby's coming into the world with their spine in good shape, and just confirm. You know, the adjustment's very different for a baby. It's just a little check and see. If you have any questions or concerns, you can leave them in the comments. And don't forget to like, comment, and subscribe.